So what does a day in the life of Dr. Ethan look like, man?
Every day is different, and that's what, you know, we have students shadow from time to time, or we'll have interns from Baker, and that's something I get to share with them is being a chiropractor is such a rewarding profession. No day is alike. It's always fun. Like, I enjoy coming to the office. I enjoy showing up and seeing what's on the schedule because it's always something different. So it kind of keeps things fresh. It keeps me on my toes. So I really enjoy, you know, that difference that we have every day.
That's incredible. You mentioned that you can customize treatment based on the patients. Can you elaborate on that more? Like, what does that mean?
Yeah, a lot of times when we get a new patient, we go back into the exam room, we have a private conversation about what's going on, what their problem is, what their symptoms are. But I also like to ask if they've seen chiropractors in the past, if they've had good luck, if they haven't, what kind of styles that they've had in the past. And then based off the exam, previous history, we kind of tailor the treatment plan to them. For some, that may be doing a manual hands-on type adjustment. For others, it may be using an activator, a spring-loaded instrument to help deliver the adjustment. We have patients that don't like to hear the pop, so we use an activator for them.
Yeah, also me.
It's just as effective, and it's just a preference, you know. At the end of the day, we always try to treat every patient a little bit differently and find that perfect fit for them. So
that's fantastic. So you talked about different age ranges as well, so I imagine that impacts the way that you treat patients.
So we see a lot of newborns in here. The birthing process itself can be difficult for some. And so when we treat babies, we don't do the quick thrust, the manual adjustments. It's more of a manipulate the joint and hold it until it releases. It works wonders for babies, but that's totally different than when we work on our Baker athletes that are big, they're strong, they take a little bit more force. Some of my tables have a built-in drop mechanism in it, so when I adjust, the table pops down. It just aids in the adjustment. It makes it a little easier on everybody involved. And so it's just fun to adapt and treat patients differently to what I feel will best suit them.